to my Lecto. Today we are going to discuss heart valves. There are four valves that are actually present in the heart. So, first of all, we will discuss the atrioventricular valves that are two in number, and pulmonary and the aortic valve that are also two in number. So, total will be four. So, as we know that the heart consists of four chamber. So, in this case, you will see this is the right atrium, this is the left atrium, this is the right ventricle, and this is the left ventricle. Four chamber and four valves present in the heart. So, atrioventricular valves are actually present between the atria and the ventricle. So, and they are two in number. So, as you can see, one is present at the right side and the other is present on the left side. Right side, you will see the tricuspid valve, and on the left side you will see the bicuspid valve, or you can say mitral valve. So these are basically the two atrioventricular valve. The structures of the atrioventricular valve are different, but the function is similar. So in this lecture we will discuss the tricuspid valve. So the function of the bicuspid valve also similar to the tricuspid valve. So if you see here that this is the structure of the tricuspid valve and this is the bicuspid valve, or you can say mitral valve. Okay. Now if you see that it consists of three cusps, or you can say leaflet. This valve consists of three leaflets, or you can say cusp, and each cusp is actually attached to the tuft of fibers, and that fibers are called chordae tendineae. So this is the situation. This tuft is actually called the chordae tendineae. So this is the situation. Three valve, three tuft of chordae tendineae, and chordae tendineae further attached to the papillary muscles. So here are basically the papillary muscles. So this is the situation. And these papillary muscles are actually attached to the or present in the ventricle. So this is the situation. And if you see here at the bicuspid valve, you see the two cusps are leaflet, and these are actually attached with the chordae tendineae. So here is the chordae tendineae, and chordae tendineae further attached with the papillary muscle. Here is the papillary muscles. Okay. Now, so this is the basic composition, and if you see here, like this is the valve, this is the chordae tendineae, this is the papillary muscle that are actually present in the ventricle. Same here, if you see, this is the bicuspid valve, mitral valve, this is the chordae tendineae, and this is the papillary muscle. Okay. Now, if we see that the atrioventricular valve, tricuspid and bicuspid, we just studied it, tricuspid valve, bicuspid valve is similar to that. So, if you see here, tricuspid valve is actually thin and flimsy. Thin and flimsy. This is the case one. It is actually thin or flexible, more flexible valve. Okay. And you see that the size of the valve is large. Size is actually large. So, what is the effect of the size in the flow of the blood? So, if you see that size is inversely proportional to the velocity, or you can say size means diameter. So, if you see that if the size of the valve or the diameter of the valve is large, then the velocity will be low, or the speed of the blood flowing through the valve will be low. So, this is the relation. When the size is large, then the velocity will be slow. And if the size is small, then the velocity will be high. So this is the case. in the atrioventricular valve, the size is large and velocity will be low. But in aortic and pulmonary, you will see size is diameter or the bore of the valve is small and the velocity is high in the aortic and the pulmonary valve, which we discuss later. So this is the situation. And if you see that the opening and the closing of the valve are basically passive. So this is the situation that passive closing and opening. This is the most important point. If you see here that when the blood enter from the superior and the inferior vena cava and enter into the right atrium. So when the right atrium contract, then these valves open, tricuspid valve open passively due to the forward pressure. So this point is very much important. Opening of the valve is due to the forward pressure. So this is, it exerts the forward pressure. So this is the important point. When the forward pressure exerts to the tricuspid valve, then it open and the blood start entering into the right ventricle. Okay, this is the situation. Now, when the whole blood enter into the right atrium, then what will happen? So, in this state, right ventricle then contract. So, in this situation, this blood that is present in the right ventricle has two options. It can either go to the pulmonary trunk or back to the right atrium. So, in that situation, you will see it cannot reverse back into the right atrium. So, this feature is very much important. And in that situation, you will see tricuspid valve is so arranged that the blood can enter into the ventricle, but the reverse is not possible. Okay. But in the semilunar valve that is present in the pulmonary trunk or pulmonary artery, and if you see here on the left side there is a aortic. So aortic and the pulmonary artery contain the semilunar valve. So in that situation, the blood will start flowing into the pulmonary trunk through the semilunar valve that is present in the pulmonary artery. So this is the situation. Okay. Now if you see, then what is the function of the chordae tendineae and the papillary muscle? So in that situation, when the ventricle contract, papillary muscles also contract. They contract the chordae tendineae, and in that situation, when the pressure exert at the tricuspid valve, so this pressure exert in this direction. So pressure exert in this direction, but the chordae tendineae exert force in this direction. So it actually prevent the bulging of the tricuspid valve into the right atrium. So this is the situation. Actually, chordae tendineae help in the prevention of the bulging of the tricuspid valve into the right atrium. So this is the situation. Now, if you see when you see that the papillary muscles paralyze, or you can say chordae tendineae become ruptured, then what will happen? Then you see that the blood will start moving into the right atrium. So in that situation, you will see the cardiac incapacity. So this is the situation. In this, you will see the blood start flowing into the right atrium, and you will see the capacity will become disturbed. So this is the atrioventricular valve. Next, we will discuss the pulmonary and the aortic valve that is present at the pulmonary valve. Semilunar valve is actually present at starting of the pulmonary trunk, and the aortic semilunar valve is present at the start of the aortic trunk. So this is the situation. In that situation, this is the actually the pulmonary semilunar valve, and this is the aortic semilunar valve. Now, if you see, they function similar, But the basic difference is that in the pulmonary you will see this is actually called the semilunar because one is actually look like the half moonlight, and in that situation you see the three cusp or leaflet in both the case, three cusp or leaflet, but the arrangement is different. In the pulmonary you will see the one anterior and two posterior leaflet, or you can say cusp, but in the aortic you will see the two anterior and one posterior cusp, or you can say leaflet. Okay, now you see that it is tough, it is tough in appearance, and even though it is flexible, but the semilunar valve are basically tough, and there is no chordae tendineae and the papillary muscle in that situation. Now there is no support of the semilunar valve, either pulmonary or you can say aortic. So this is the situation, and in that situation you see the size of the valve is small. So it's mean then what will be the effect on the velocity of the blood? Size is small, and in that situation the blood ejection will be rush. So in that situation at the right ventricle you will see blood will enter into the pulmonary artery will rapidly. So and here is the aortic case. So this is the situation, and in that situation you will see this valve open when you see the ventricle contract and blood enter in that situation. After that you see when the blood enter into the pulmonary artery, or you can say aortic artery, then in that situation the backflow will close the valve. So this is the situation. Now open, so close will be the backflow of blood, and open valve due to the forward flow. So this point is very much important. Keep remember that the valve open when you see the forward pressure, and valve close when you see the backward pressure. This is the important point. Okay, now in that situation you will see that the opening and the closing of the pulmonary and the aortic semilunar valve is relatively faster than the atrioventricular valve. So in that situation you will see the mostly the mechanical aberration in that situation. This is all about the heart valve. If you have any question then you may ask in the comment section. Thank you.